clinic. My cranial nerve clinic. I'm going to be talking nice and softly and slowly today because it is late and there are other patients sleeping in adjacent rooms. We're trying to get some sleep at least. So, I'm going to begin by taking some information from you. I understand that you've had a little bit of a trauma and you're looking to get your cranial nerves checked to make sure that there's no injury there. Okay, now I have tried to have a little look in the system to see what I could interpret from your initial form that you filled with our receptionist, but there's not a lot there, so just bear with me. Can you just confirm your name for me, please? Okay. Alright, now we do have an address here for you. Can you just repeat that for me? Yep, that's what we have. We don't have a mobile number for you. Can you please give me your mobile? Alright. And an email address. We can send a copy of your results there. Alright, excellent. Thank you for that. Appreciate it. Okay, let's have a quick note. I don't have much medical history here at all for you. Can you just let me know if you're currently on any medications or you're being treated for any condition at all? Okay. And when was that from? Ongoing, okay. Do you take any medication for that? Okay. Anything else? Okay. From when? And any medication for that? Okay, anything else you want to add? Alright, now about your injury or accident, can you let me know what happened to you today that's brought you in here to see me? Alright. Okay. Alright. Okay. Alright. And how long were you unconscious for? Just... And when that happened, what did you then do? Did you come straight here? Did you go and see anybody else? Okay. Okay. Alright, well, it was the right place to come. And what we're going to do today is I'm going to go thoroughly through all of the cranial nerve tests. Now, we will be here for about an hour. Alright, but I like to take things nice and slow and keep it relaxing. I I don't want you to be panicked, and especially since it's late at night, it would just be nice. We'll keep it nice and relaxed. Okay, bring the energy down. Now, I do like to give my patients a calming tea, so I'm going to give you that in a second. You're not allergic to anything, are you? I didn't see that in your notes. No. Okay. Well, I'm going to also light a little candle as well here. This is one of my favourite candles. It is this beautiful, uplifting lemongrass and rosemary. I just think it's particularly wonderful, and it just gives a nice ambience to the room and the atmosphere. So I'm going to sit this actually just here, and we'll let that crackle behind you. Alright. Now, that tea I promised you. So, this is actually a special tea that comes all the way from Poland. And it is calming but fruity, so it contains different, you've got your chamomile, lavender, but it also contains some florals. There's also orange peel in there as well. It's a really fruity but relaxing taste. So, would you like a cup? I think it would be good, and it will also help us be able to see how well your masseter muscles and your swallowing is. Sometimes they can be affected by cranial nerve injuries like yours. So, let's pour this into a wonderful teacup for you. It's a little bit full. Smell that. Very nice and fresh. I'll have this seated to your left, okay? Just help yourself at any time and just gently sip from there, okay? Alright, now we're going to be checking your olfactory cranial nerve first. Now, your olfactory cranial nerve is responsible for the innervation of your nasal cavity and your sense of smell. I'm just going to pop these off just now because I find it hard to open the oils. So how we're going to do this is I have a wonderful selection of essential oils with distinct scents. Now, you may not be able to name them, and that's absolutely fine, but I want you to describe the scent if you don't recognize it, but you can smell it. And we're going to test variety from sweet to sour to floral. Okay? Alright, let's begin. Our first scent. I can already smell these beautiful scents. They're leaking from their beautiful little bottles. Trying to just undo the cap enough so that you can smell. Okay, the first one here. So just take a deep breath in, just breathe in through your nose and out through your mouth. It's spicy. You recognize the scent? Okay, you're correct. It's a spice. What is it? Yeah, herb. Yes, so this is rosemary. good. So you kind of got the herby, spicy scent down. That's good. All right. Okay, this is a very different scent now. Okay, perfect. I've got this up just enough. So here we are. Just breathe in through your nose and out through your mouth. Yes, you recognise it. It is often used in skincare and has a really sharp scent. It is tea tree. You're absolutely describing it bang on, so well done for that one. Very, very good. Alright, we're going to come now to a different scent. Also quite sharp, but we'll see what you make of it. I'm just gently opening this. We just turn the nozzle very slightly so that you get a little draft of it. Yep, here we go. Okay, so just breathe in and out. Breathe in and out. What's your thoughts? It is eucalyptus. Very good. Okay, well, I think you definitely can get the strong scents. Let's see what else we've got here. Okay, different scent for you. Let's see if you can work out what this is. Breathe in through the nose, out through the mouth. Yes, well done. That's very quick. Rose. Indeed, perfect. Well done. Okay. It's a floral. That's beautiful. You still smell it. This is my favourite part of cranial nerve testing. I just love the scents. Okay, this one you should be able to guess what this says. I think you will also get this. It's also, I would say, floral or calming. Yes, it is lavender, indeed. I thought you would get that, no problem. Okay, well, we need to try something slightly different now. Okay. To see if you can get this. Now, I can smell it already. Here we go, pop that up. Okay, just don't want too many scents to be in the air so that you know what this is. Okay. Alright, didn't you? I should have had coffee. Coffee's very good for getting rid of any lingering scents. Just inhale through the nose, out the mouth. It is citrusy, that's correct. Yes, it is sweet orange. Very sweet and beautiful. Alright, well, I'm pretty happy with that. As you can see, I have plenty here that I could have gone through, but I'm happy with your answers. We did do a variety of different ones, so I am confident that there is nothing at all wrong with your olfactory nerve. Satisfactory. Wonderful. Now, I am going to just quickly check your heart rate and your blood pressure. Now, this is not to check any of your cranial nerves, but because of the I just want to make sure that everything is in working order. Okay. We'll start with your heart rate. I'm just going to listen to your lovely heart now. It may feel a little cold. I'm going to just place it underneath your top, okay? Just nice and still. Breathe in and out, and in and out, and in and out. Yes, I'm pretty happy with that, so that looks good. Okay, so I'm going to quickly check your blood pressure, alright? Well, we're using the old-fashioned rather than the electronic machine. So just pop your right arm in there for me. Wonderful. I'm going to put my stethoscope on again. Okay. I'm just going to slip that on there. Alright. And again. And one more time. It was absolutely fine. I'm just going to take this off your arm. Thanks. Yes, there was no irregularities, nothing like that. Your blood pressure is fine as well, so I'm happy with that. Alright. Let's just note that down. So we've got heart rate and blood pressure is good. Satisfactory. That's my favourite word at the moment. Satisfactory. If we can get you all satisfactory today, then that will be fantastic. Right, so we are going to now look at your eyes. Okay. Are you nice and comfortable? Would you like another cup of your tea? Let me swig there. Okay. So your eyes. We have quite a few little tests to do with your eyes. what I'm most concerned about is I want to actually have a really good look in your eyes, okay? So I'm going to ask you to do lots of different things for me so I can get a really good look and see how your pupils react and also the muscles in and around your eyes. Okay, I'm going to use this torch and I want you to just look up for me. And look down for me. And then to your right. And to your left. Look up again. Look down. To your right. And to your left. And one more time. Look up. And look down. To your right. And to your left. Okay, now I've got this light. And I'm just going to see how your pupils react to it when it's flashed away, okay? So just look at my nose, okay? Okay, now if you focus on this finger, I want you to follow this finger all the way in to here, that's a cute line. And keep watching it as a backside, don't look away. Keep following the finger. Okay, and again. And one more time. And back out. Alright. Okay, now we're going to look at your peripheral vision. Now what that means is I'm going to bring some fingers in from different parts and you've got to stare right here at my nose. Okay, and I want you to tell me if you can see them. And we're going to do it with both eyes, so I'm going to cover one of your eyes. And you need to tell me when you can see it. Okay, so I'm going to start with doing your left eye and we'll cover your right eye. Okay. Alright, and we'll cover now your left eye and we'll work on your right eye. How many fingers am I holding up? Good. How many fingers am I holding up in this hand? How many fingers am I holding up? How many fingers? Good. Alright. Well, for the initial part of your eye exam, I think that it is completely satisfactory. Okay. Now we have the next part. So I'm going to need you to do an acuity test for me. We have this here. Wonderful as it is. I'm just going to get my little pointer. want you to read all the way down to the bottom, or as far as you can go, starting with the top letter. Yep. Yes. Great. All right. And the last line, can you get anything on there? Yep. Okay. Thank you. Now, we're going to look at your colours as well. It's important that we make sure they are not affected. Sometimes they can be. So, please tell me which number you can read in this. Alright. What number can you read in this one? Let's take your time. What number in this one? Alright. What letter in this one? Your turn. Okay. Let's try your blue red letter in this one. Okay. What shape is in this one? Okay. How about the shape in this one? Shape in this one. Alright, is there any more? Yes. Shape in this one. Okay. Alright. Very good, so your visual acuity is fine. And your colourblind test, that was fine. You struggled a little bit in some of the high contrasted ones, but that's to be expected. They are difficult, so don't worry about that. So, high contrast. But okay, so eyes are absolutely fine. Right, now we need to move on to examining your ears. Okay, now I am going to be looking at the nerve that supplies your hearing. But first of all, I want to actually take a peek that would maybe affect your hearing test. So I'm going to use this little otoscope. I'm going to check, I'm going to feel around your ears, and we're just going to see what's going on first before we move forward with a hearing exam. So I'm just going to gently come around this side. I'm just going to feel the side of your face and then around your ear. We're just going to come over to this side. Feel fine. So let's have a look in there, shall we? I'll start over here with your left ear. Okay. And now let's have a look in your other ear. Alright, okay, we're just going to put that in there now. Other than a little bit of wax, I can't see anything at all that would concern me. So, I think in terms of structure, it's fine, so it should be working normally. So I'm just going to ear exam, normal in appearance, and minimal wax shouldn't affect hearing. Alright. Okay. So we are going to move on to your hearing test. We're going to do two different things. We have a tuning fork. I'm going to sound it 3 times, and you are going to tell me when you can no longer hear it, okay? And the second is our whisper game. So what we do is I make a distraction in one ear and I whisper a word in the other, and you just need to repeat it back to me. Okay, so we're checking to see what your pitch and your also checking to see if it can pick out something when there's a lot of distraction as well. Okay, here, take another little sip of your tea just to relax you before this session. Okay. Alright. Here we go. Ready? Very good. Next one. And final one. Alright. So tuning fork. Yeah, that was absolutely fine. Okay, there's no problems there with your spells, nothing to be concerned about in relation to your cranial nerves. Alright, now the distraction test. I'm going to begin by whispering in your right ear, and I'll distract your left. And remember, you just need to repeat the words that I whisper into your ear. Okay, let's begin. Sausage, candle, midnight, cherry blossom, snowdrop, mirror, light, meditate, sandwich, banana, mustard, perfect. Alright, let's do it now into your left ear, and I'll make a distraction as well. Okay. Hair bubble, makeup, vanilla, microphone, trainers, sunshine, holiday, medical, lip balm, matches, perfume. Very good. Okay. We've got all of them. So nothing wrong with your cochlear nerve. Okay. Alright, we're going to move on to your sensory tests. So we are going to begin with soft, and then we'll move on to hard. So you have different types of sensory neurons. Some will detect really soft and gentle touches, and some will detect hard sharp touches, and it's different reflexes per nerve. So we're going to begin with the soft, and I've had a number of different things that we can use to try and see if you will feel it. We're going to do it in and around your face and your neck. Okay, so our first soft object is this here. And I just want you to tell me by simply just nodding or saying yes if you can feel the touch of this on your face. Okay, we'll start here. Okay, and then down your neck. And your ear. Other side. Okay. Object 2 is softer yet. I'm just gently going to touch the very tip. 2. Strike it. And we're just going to follow it down your neck. So and your ears. Your other ear. Alright, and now the third soft item is this. I'm just going to touch gently with one of these little things. Oh, got the tail stuck there. Sorry. I'm doing good. Then your neck. Your ear. Alright, well, I have no qualms with your soft nerves. They felt absolutely fine to me. Soft nerves. You were able to get all of the touches, so very good. Alright, now for the sharp ones. Now, they're not going to be painful. I shouldn't be uncomfortable, but you'll notice some of them are slightly sharper. Others, I beg your pardon with these yawns. They said it's late at night, so tired. Okay, we're gonna do the exact same thing. Okay, well, this is the first one. Now it looks sharp, and the same one I've got a couple of pins, but we're hardly gonna touch it. We're literally going to just put the edge, and you'll be like, oh, but it will not feel Alright, it's not sharp, but it should still invoke the same reaction, okay? So, let's go again. Touch. Alright, and the final one, now we're going to take a pen. I like the blue colour. We'll do a blue pen. Okay, it will feel sharp, but it will be very gentle, okay? Make sure that's nice and shut tight so we don't lose the pins. Okay. Very good. So there was nothing wrong either with the hard, sharp nerves. Very good. Completely happy with that. Okay. Now we're going to move on to your reflexes. We're almost near an end, so don't worry. We've just got a few more things to do. So, I want to look at your facial movements. Now, I've seen a fair few of them already, but we're just going to go through the motions again. So, I'd like you to raise your eyebrows for me, nice and high. Okay. Okay, now can you scrunch your eyes up really tight? Scrunch, scrunch, scrunch. Scrunch, scrunch, scrunch. Yeah. Okay, very good. Now give me a really big smile. Yeah, good. And then puff your cheeks out. Alright. Okay, can you open your mouth wide for me? Take your tongue out. No, wide. And then put it to each side. So put it to your left and then to your right side. Yeah, like that. Okay. Good. Right, I'm just going to touch the tip of your cornea, which is the corner of your eye. With this, you will not feel it, but your eye should react. Let's see. Yep. Then your other eye. Okay. Now I'm going to hit this off just under Is it nice? Yeah. Nice and relaxed. That's good, isn't it? Okay. Your other knee. Ready? Good. Perfect. Now I want to look at your movement of things. So if I put my hand here to your right cheek, I want you to turn to your right, okay? And push against my hand. So turn your head, yeah, like that. Alright, and I want to feel that resistance, yeah. Okay. And then this. You do move your head. Yep. Move to your left. That's it. Very good. Very good. Okay. Now I'm going to put my hands on your shoulders. Right. I want you to try and shrug your shoulders against the resistance. Okay. And just shrug. Alright. Again. Alright, I'm feeling that. Yeah. And one more time. Okay, very good. Very good, very good. Okay, now I want you to swallow for me. So I want you to take a big gulp of this, okay? Hold it in your mouth. No, so take another sip. Hold it in your mouth. Okay, keep holding it in your mouth. And then I want you to gulp. Swallow. Yeah. Okay. I want you to do this as if you're chewing. I'm just going to feel your masseter muscles. Oh, right. Okay. And it wasn't sore to scrunch your eyes or any of that? No. Okay. You look a little bit sleepy now. Are you feeling sleepy? Alright. Well, your facial nerves and movement, they're all working well. So I could feel the resistance when you were moving against my hand. I could feel your muscles chew, your tongue's not wasted. Everything is in working order. That's like the third yawn. Okay. All is in working order and condition. So well, what a session that was. We did a very thorough examination of your cranial nerves along with some vital signs, and there's not a single thing that has flagged up. I understand that obviously today was a very traumatic accident to have occurred, and you did become unconscious for a time, albeit short but still unconscious. So based on that, I would assume that you are concussed. Okay, now concussion is different to an actual cranial nerve injury. So with concussion, we just want to keep an eye on you. Just make sure that your pupils are still responding to light. If your pupils are super dilated and they don't come down, then obviously call us back. If you start being sick, call us back. Keep an eye on yourself, and ideally have somebody to watch you just in case you deteriorate. But I do think everything looks and it feels really good. So I'm pleased to say that you are off of the hook, and there's no need to worry. Now tell me, are you going to head to bed? I think that's a good idea. I think I'm also going to head to bed and call it a night and go for a nice sleep. So hopefully somebody's got you a nice warm cozy bed to go back into when you get home. No, you are my last patient of the day. is not far, really not far for me to travel home, so it'll be nice and quick and smooth. Now, you do have a bit of this left. I'm gonna drink. It might have gone a little bit cold, mind you, but just one little sip. You don't want any more. That's fine. I'll pop that there and make myself one as well in a sec. I just need to read it in the staff room. And we're just gonna pop this out. It smells wonderful though, doesn't it? I want to get rid of them. I'm gonna pop it in there in your tea. Relax and then nice and clean. Because there was a lot of dust on there. But that looks wonderful now. There we go. Okay. Sorted. See? Nice and clean. Nice and sorted. My apologies. I am rambling and just keeping you here for absolutely no reason at all. Alright. Okay. Well, take care of yourself. And if there is anything else, like I said about a million times, just come back in and see us. But I do think that there will be no problems at all. This will all go through to your GP or general practitioner, so they will get a copy of your visit today. Of course, if there's anything at all that comes up, contact your GP as well, you know, even if it's in the next week or so. They'll have a record of this and they'll be able to assist you or get back in touch with me. I don't think you need any medications. I'm not going to send you away with any, so I think that's all fine. And of course, because your heart rate and your blood pressure was fine, I don't think we need any further action there either. The only thing I was going to say to you is just make sure to keep up with your Acuity tests at the opticians. You just, you know, there's a slight bit there, nothing to do with your cranial nerves, but just a little bit of visual acuity issues based on age. That's all it is. Alright, well, I will let you go after rambling your ear off, and I will hopefully not see